importance of physical therapy. Regardless of the approach, physical therapy is essential for optimal recovery. Your therapist will guide you through exercises and activities tailored to your needs. Post-surgery, you'll wear a sling for up to 6 weeks to support and protect the shoulder. Gradual progression. Your surgeon will determine when to start therapy. As you progress, exercises will be modified accordingly. Commitment to therapy. Adhering to your therapist's instructions is crucial to avoid joint damage and ensure a successful recovery. Recovery expectation. Pain reduction. Most patients experience reduced pain and improved function after recovery. Gradual improvement. Regaining full range of motion may take time, and physical therapy can last up to 6 months. Patience and caution. Avoid exceeding prescribed exercises to prevent setbacks in your recovery. Understanding the 2 shoulder replacement options, conventional and reverse, provides insight into the surgical process and recovery expectations. Your surgeon and physical therapist will work closely with you to ensure the best outcome. Embrace the rehabilitation process, follow instructions diligently, and soon you'll enjoy improved function and potentially a pain-free life, capable of completing daily tasks with ease.